Welcome back and moving on to our first segment for today, talking about the 100 Healthy Days Healthcare Campaign. One of the most important campaigns that has to do with providing the best medical awareness and treatment and protection for the Egyptian citizen. Over the phone, we have Dr. Hoda Rezkana, Professor of Intensive Care, Faculty of Medicine, Cairo University. Hello.
Hello,
Good
morning.
morning. Good morning, doctor. First of all, I'd like to shed the light on this important campaign and its impact on the Egyptian citizen.
Well, as a matter of fact, this is one of the pillars which we are going to depend on for the next stage of our life, because health of the Egyptian people are mandatory and very important pillar to work on and to develop a new generation of citizens who are enjoying complete mental and physical health, and they can serve their country well. So this is a very important campaign, which I endure that this will create a generation which affords the burden which is coming in the next years.
Right, doctor, talking about the services provided, could you give us a general idea about what sectors we are talking about, what kind of services are provided?
I think, first of all, we took the stage of the childhood and mother care and childhood care, which is a very important area. We have to build on it, how to discriminate or to differentiate between health in different areas in Egypt, because it responds, the health of human health will depends on the area the people live in. So if they are enjoying a good earth and good environment, and good plantations and healthy one away from any pollution, this can be a safe environmental area, and the people there will enjoy a healthy physical and mental health, and they will be raised on an excellent environment which can provide an excellent human and physical well-being. We all try to achieve the optimum health status according to the international levels and according to our criteria as Egyptian here. So we need to eliminate any foreign factors coming to this environment and try to protect the people and to screen the whole population if they get any contamination or any hazards from the environmental changes around us all over the world. Because you know that everything is transmitted, so we have to provide the protection for the young generation and in the childhood phase course, and the babies and their mothers, and to ensure that they enjoy natural, healthy lactation period, and they enjoy also balanced food and balanced life and their environmental stats. So I think one of the best tools that we have to provide this protection and survey and make a screening by lab work and also by testing the groups around in the environmental governorate, different ones, because we have sea border and we have a desert and we have agricultural areas. So every human being live in a different location needs to be provided by a healthy and clever diagnostic processes which declare the health status and provide them with the essential the fix they are looking for.
Doctor, I think one of our main challenges we used to confront actually the concept itself of making checkups and
Yes.
also talking about changing the mindset. When you talk about the Egyptian family, especially if you're talking about the mother in particular, rarely this mother will go to make checkups on actually annual basis or something of the sort, and usually we used to just not to be in that the idea or the concept of visiting doctors and taking some prescriptions on our own. This actually initiative or campaign changed a lot when it comes to one of our most bad habits actually.
Well, frankly, I should speak to you frankly. There is some families and some mothers who cannot leave home easily. She's tied with her work at home and other children's around, and if she's a new labor, and she has a new baby, she has to receive a service at her home till she can get healthy enough to visit the doctors in the designated unit in their government or in their area. So we might help her in the first stage by paying a visit and put a card for her which denotes what are the areas deficient in her area surroundings. Is there any diagnostic clinics? Is there any lab work? Is there any X-ray tools? So this will serve the patient whenever they need to be served. So what I mean by this, that we have to extend our hands to the people who are not able to move. First of all, in this faraway areas and governorates who are lacking maybe good service or maybe communication with higher levels of doctors or university doctors. So we provide this service to give her the least possible help till we can get her to the area which can have a full service of diagnosis, and we rebuilt on it that this family gonna be enjoying a healthy mother and healthy children. Also, the husband should be examined because this is not only mother and child. The father should be provided also with a lot of help because he's the one exposed to the external environment all the time. But the idea that we serve them at home is very good, and it gives a good result because psychologically speaking, they feel that somebody gives them attention, somebody is caring, the government is keen to provide them health and wealth also. So I can give them the medicine free of charge in the first stage, and then to make a study if they can provide through the medical insurance their required medication and required examination. And thus we are sure that we have a healthy line of population which can step on and make a more optimistic future generation.
Doctor, this campaign is also not only limited to Egyptians, but also to foreigners living in Egypt, taking all the rights of the Egyptian citizen.
We have to raise our alarm flag here, because anybody step from outside to our country should be screened. They are maybe exposed to other external factors, maybe to infection, maybe to radiation, maybe they are carrying some items which exposed to, these are people were suffering around the world, and they were working and moving between countries, and they carry whatever they are gonna tolerate, and they should be screened to provide a healthy screen about their mental and also physical blood screen test and culture test, because we will discover a lot of transmitted diseases and a lot of pollution, and also we have to examine their stools and urine, because they are gathered from different areas in the world, and each area has its specific and pitfalls. I mean, maybe they are exposed to viral infection, maybe they are exposed to nutritional lack of nutrition and healthy nutrition, which gives them blood. The picture will be different than the people who have a healthy and good balanced diet. You got me? So
Yes.
we have to eliminate all these factors because they are bringing their illness to us if they are sick, and we have to provide the health for them as we have a good intention for them, and we have a good intention to our people.
Doctor, you mentioned in the beginning the children, of course, for included in this campaign. Let's talk more about it and what kind of services are provided, and are these campaigns reaching children at schools, for example, or tell us more in this respect.
I think we are providing an optimum service for a lot of people who are coming into this country. And they should be appreciating that, because as long as we provide them examination and screening and diagnostic tools, they can make sure that they are going to be treated, and they should be indulged in this society in a healthy way. Because to tell you the truth, the most and the vast element which can spread between the population is through children. So children are vulnerable and weak, and they can contaminate a lot of foreign elements, which can spread quickly through the family and through the other children. And the school area, because you bring your child in the school and you don't know what's surrounding them. So school children and at these primary areas of the age, they should be fully screened and watched to diagnose early signs and early symptoms if they suffer from any tools, because they are lacking nutrition, lacking vitamins, lacking a healthy way to sleep, because maybe sometimes they put them in camps abroad from Egypt, because Egypt here provide them with an optimum level of living of services. So we cannot compare ours to the other countries. We have a lot of passion to these people, and we sympathize with them. That's why we are trying to offer the maximum service that we can offer them, providing that a healthy population will provide a healthy environment. That we need.
Right, Dr. Hoda Rezkana, Professor of Intensive Care, Faculty of Medicine, Cairo University. Thank you very much for joining us. Right, moving on to a quick break, then we'll be back with more on The Breakfast Show.